Hello, welcome to Drug Talk. I'm Matt Hamilton. Today we're discussing fentanyl, how mistakes that are made with this drug can harm you as a person, and what to do if those harms fall upon you. I'm joined today by Doctor Jesse Garcia. Welcome, Dr. Garcia.
How are you doing, Matt?
Dr. Garcia, what is your area of specialty?
I'm a clinical pharmacist. I specialize in drug interactions and then those interactions on the human body.
I see. I'm a trial area attorney. I'm talking about drug errors. My name is Matt Hamilton. And Dr. Garcia, mistakes with fentanyl, how can they harm a person?
Well, fentanyl is a very potent opioid, typically used for chronic pain, or in some cases we see it used in hospitals. Drug errors themselves can harm patients because of some of the potential side effects or problems that can result from misuse or not converting the drug properly. So some of those errors could potentially be respiratory depression.
So if we're talking about an error in a drug-drug interaction or an error in a conversion, we're really talking about an overdose.
We're essentially talking about an overdose. Okay, basically the body has too much of the drug in the system, and it begins to cause negative harm. So the idea behind pain medication is give the smallest dose possible to relieve the pain, but not go beyond that. These medications, these opioid medications, don't typically have upper limits in terms of the number or the max dose that you can give. It's really dosed based on the fact of how well is the patient tolerating the medication. So are they being relieved with this medication? Is the pain gone? And then we take that dose and we continue to raise that dose to a point where we feel comfortable with it, as far as the pain being relieved. Now, when you try to push that and maybe go even higher, say to the highest levels of the medications, which we typically don't recommend, that's when we potentially see problems, because now you're putting yourself at risk for potentials of overdose. So some of those might, you might not notice them right away because one of the problems is respiratory depression. So what you might see is you might feel out of breath. Okay, so that's something that you need to watch for when you're starting these doses. When you run up a flight of stairs and you ran up just fine the day before, then a couple days later you're on this fentanyl patch and now you're not able to get up the stairs as well, or you get to the top and you feel out of breath. Okay, that's one. So you want to tell folks who are around you, be it family members, caretakers, to be mindful of this, right? They want to be mindful of the fact of it, you may not notice it, but they may notice it. And if they notice those, or if they feel like you're at a point where you are now kind of not with it, so then they can inform the physician, so then they can say, okay, maybe we need to back down this dose.
I see.
Maybe we've now pushed the point beyond where we would like to be.
Well, how severe can the harm be from an overdose in fentanyl?
You're talking about respiratory depression, so you're talking about potentials with not getting enough oxygen to the brain. You're not getting enough oxygen to the tissues. So
can that cause brain damage?
It can cause brain damage if you're not getting enough oxygen to the brain. The hope is that you could be administered kind of a rescue medication before that would happen. But there are instances and possibilities of having brain damage and thus including death because you're not able to get oxygen to the tissues that are needed.
So if somebody's been overdosed in fentanyl and they haven't been advised of the necessity to immediately seek medical treatment, this can cause brain damage or even kill somebody.
Correct. Mm-hmm.
Okay.
Absolutely.
And that pharmacist or that doctor should have told that person or their family members about what to look for.
Exactly. You should be counseled on those medications to let you know what you should be looking for, especially when you go into the pharmacy and say for instance, the fentanyl patches, they come in 25, 50, 75, and 100 micrograms per hour as a release. Okay. So if you've never had it before and you maybe have been converted out of the hospital and the pharmacist sees no history of fentanyl, and then you start out at say 50 or 75, that should be a red flag to the pharmacy to say, wait a minute here, we've never had this before, let's initiate the consult. Okay, where then we'll talk to the patient, hey, have you had this before? What have you been getting at the hospital? To ensure that we're not starting out too high.
Okay. Pharmacy should talk to them about this.
Absolutely.
Okay. Doctor as well?
Of course.
Okay.
You should be counseled on all your medications before you leave the physician's office, because at that point of contact, they're giving you medications, they should be talking to you. Part of that, part of making sure that they are treating all the conditions is going through that list with you and saying, okay, this is what this medication is treating, this is what you should expect, these are potential problems you might have with it.
And they fail to do that, they can permanently harm or kill someone.
Correct.
Now, I remember in part 1 of our series, you talked about Stevens-Johnson syndrome.
Correct.
And toxic epidermal necrolysis.
Correct.
And you instructed us to look for flu-like symptoms or even a purple rash on their body.
Yes, sir.
As signs of Stevens-Johnson syndrome. How bad can Stevens-Johnson syndrome get?
So Stevens-Johnson syndrome at the core can be, at mild cases of it, you're looking at flu-like symptoms. As it begins to become more severe, you're looking at, rash along the neck, chest area. That is that purple kind of signature rash.
This is a disease that progresses.
It can progress, correct, because now what you have is instability within the tissues themselves. So the skin is made up almost kind of like a ream of paper, okay? Many layers that are real thin layers that then give you protection. So Stevens-Johnson's can basically affect the integrity of those bonds. So the paper almost begins to peel away, so the skin layers come off. Now, as that progresses in terms of how deep it goes and the area at which it's covering, you have problems with regulating temperature, you have problems fighting off bacteria, not to mention just in the fact of now you're exposed to a lot of elements that you weren't in the past, and it's progressing. Now, when it gets to the point that it's 30%, we then deem it 10, which is basically toxic epidermal necrolysis, okay, which basically means that it's now progressed on beyond that 30% mark, and that is definitely deadly and very difficult to recover from.
It can kill.
Absolutely. Yeah, you have to be segregated almost in a burn unit, basically, because it could be that bad, and you're basically your immune system is compromised because now you're exposed to a lot of kind of outside infection, bacterial infections or potential problems because that protection layer is no longer there.
So if somebody's exhibiting symptoms of an overdose or Stevens-Johnson syndrome, then they need to not wait around, not just set an appointment. They need to contact medical treatment instantly, immediately.
They need to get in and get seen, especially with the symptoms of the overdose. I mean, not to say that Stevens-Johnson's isn't something that needs to be dealt with immediately, but there are rescue medications that are designed specifically for opiate medications. Okay, so those need to be administered as soon as possible. You will typically find those on your EMS trucks. They will have some of those type of rescue medications. So you have to let them know, okay, this is what a patient has been using. Okay, we just got this fentanyl patch. And so that's important to let them know even at that stage, right? If you're going to go to the...
So some patients that have died from fentanyl could have been saved simply if they'd known enough to contact the ambulance.
Yeah, if you contact the ambulance and they come and they're able to administer that medication, that might be able to get you to the point where now you make it to the hospital and then can be treated from them. So that's why it's important to let them know whenever you're dealing with these opiates.
Well, Dr. Garcia, it's once again been very informative. I appreciate you talking today about fentanyl, how the mistakes can harm, and what you should do. For more additional information, I'd encourage you to go to our website. It's worldwideweb.law-kc.com. We have a lot of information on fentanyl overdoses, the research you can do to learn more about this syndrome, and some of the harms that can be resulting from these errors. I'd also encourage you to go to our Stevens-Johnson syndrome pages, as you can learn a lot there. We've done several videos, not only on fentanyl, but also on Stevens-Johnson syndrome and toxic epidermal necrolysis. I'd encourage you to watch those. They're very informative and will help you perhaps avoid some life-changing harms. This is Matt Hamilton, it's Drug Air Talk, and thank you again, Dr. Garcia. It's been a pleasure.
Thank you, Matt.